PCOS, some people say PCOS, is essentially polycystic ovarian syndrome, and it's an endocrine disorder that we see in reproductive or gynecology as well. It affects 1 in 8 women, and essentially is a triad of symptoms. So you have irregular periods or very prolonged spacing out of your periods, or you have less than 8 periods per year. And this is one of the main things that women and girls come in complaining about, that I don't see my periods, or it takes a very long time to get a period. The second thing is that we see features of polycystic ovarian syndrome, or PCOS, which are to do with an imbalance in hormones, where you have a raised androgen. We call it androgen, and the main hormone is testosterone. And this causes things like hirsutism, hair growth in the male pattern, so on the chin, on the chest, on the lower abdomen, at the back of the legs, or acne, which is very resistant to treatment, alopecia, which is sort of hair loss on the scalp mainly. But it also has other implications: obesity in the central region, problems with absorbing sugars, so you have high insulin levels, and other things like sleep disturbance, anxiety, depression. And if you look at the syndrome, it usually happens in women of reproductive age, and therefore one of the other main things that we see are women who have fertility problems. So because they're not ovulating regularly, they're not having regular periods, they then have a problem with trying to conceive. It may take them longer, or they may need some help to try to conceive. So when we scan for polycystic ovarian syndrome, we look at the ovaries mainly. And if your ovaries are more bulky, they have small follicles, more than we normally see in a normal ovary, then that also goes together with what polycystic ovarian syndrome is. Exercise, diet and weight, and looking after yourself, having good sleep, and having people to talk to, and dealing sort of with stress management is very important in PCOS. That's the first thing. And then we can think about management in terms of medication. So one of the main common ones that we use is that if you have this sort of imbalance and you do need to have, then we can use contraceptive medication and contraceptive hormonal pills to try to give you a regular withdrawal bleed. This ensures that your uterus remains healthy in terms of the lining of the womb stays nice and thin, because one of the problems of having PCOS is that if you do not have regular periods and you have very long, prolonged periods of no cycles, most women lead a really good life, a really healthy, normal life. This is not something that hangs over you like a cloud, but it's something that you can always reach out for. There's always someone to help you with that, whatever is causing the issue at that time. So I would say there's a lot of hope and lots of management that we can work on with you.